Medical Dilemma.
Welcome back to Medical Dilemma. Before we start our discussion for the second segment, I'd like to say thank you to our major sponsors, St. Clair's Medical Center and LifeQuest Training Consultancy Corporation. Now joining me for the second segment are my co-hosts, Attorney Sara Suguitan and Father Jerry Manlangit and Attorney Teresita Sanchez. Now before we took a break, we were talking about the lifestyle changes that need to be made to prevent stroke. Okay? And Dr. Nobles, maybe you could give us again a brief summary of what we had talked about regarding prevention.
When a patient comes in to us and definitely he or she met the requirements of having a stroke, what is important is, of course, to stress the fact to the patient and the relatives why in the first place he had that stroke. That's why we enumerate the different precipitating factors that may be responsible for this. Number one is, as in any part of the world, is hypertension. So poor control of blood pressure, non-compliance of medication, that is very common. Lately, I have lots of patients who come in who feel they're good, they're well, and their regular physician didn't say anything about maintenance, and they stop it, and here comes the holidays. Of course, they were abusing how they eat, so they suffer.
Because it's really possible to have a high blood pressure and you don't feel anything, right?
Yes, definitely. A lot of people may be asymptomatic. As for the same as to the second probable cause, diabetics, a lot of patients may be diabetic without knowing it. Okay, but the other factors, they know it. The third factor is, of course, body build. You know when you're heavy, period. So there's a way of finding out if you are in your ideal body weight. And I can boast, being a doctor and a neurologist, I always say that I have to maintain myself with the ideal body weight. If not, you're a candidate to having stroke, no matter what.
I know Perry before, and really he was on the other heavy side before. Now it's
Congrats
fine.
on maintaining your body weight, ideal body weight.
And
Did
it's
you
hard.
do it, Doc?
I said, of course, diet and exercise. There are no two factors that may contribute to good body weight, but diet and exercise. Fourth is, of course, and fifth, which I mentioned a while ago, is, of course, stoppage of vices that may be really, of course, detrimental to your health. Smoking.
Smoking.
Drinking.
Drinking.
They still,
How about
it's always okay to, you hear a lot of wine being good and certain liquor products being good. But remember, what is the problem? We don't do it in moderation.
It has to be in moderation.
Perry, how about gambling and womanizing? Kasama ba yun?
Hindi, alam mo, ang problema dyan, forgive me if I talk in the vernacular, ang problema sa mga ganyan, if one goes into that, definitely there is stress that comes into it. And that's why you hear a lot of people at the height of gambling or at the height of, may died on top, alam mo na yung mga gano'n. Na-stress siya. No? Nagka-stroke. No? Clinically, nag-stroke yung pasyente. So, definitely, it's more of the associated stress and perhaps the increase in the blood pressure that may come with such practices, event. So, yung isang sinabi ko nga, very important na we cannot be really preventive of is the fact that family history. Kung alam mo na may history sa pamilya mo, mag-ingat-ingat ka na. Especially when you're already in the age which is already prone to developing stroke.
If you have blood vessels that are already very hard and resistant.
Kasi ang taas-taas na ang history ng family history. Both parents and even near relatives, first-degree relatives have already a history. Sige pa rin. And something that I want to always stress is the fact that stress is really one of the things that we tend to forget. And who is not devoid of stress? Stress is it's a moving factor in our lives. But at the same time, it can go downward spiral. Kung pangit, it affects you emotionally, how you deal with your colleagues, with your family. Then definitely, I hate to say it, it is a contributory factor for having stroke. I've seen a lot of patients who have their executive exams, normal, nagkaroon ng stress lang, tapos later on,
something.
so, hindi biro yun, no? I know it's hard, but there are ways to handle stress. And I think that may require another session, but then of course Father will be knowledgeable of that.
Well, you know, which means that if you have stress, it is something multifarious, no?
Oh yes, definitely.
Because in all facets of life.
Connected, hindi mo maaalis ang
Whether
relationship
financial
stress.
or financial, marital or something like that.
That's why you have to find out when one is stressed or you admit being stressed, if it really affects you to that much that it affects your health already. So, check up. It
Right.
depends it really pays to go to a regular doctor.
Change your lifestyle, right?
Yes.
Resign from work if you can.
Oh boy.
I mean, if you change your boss if you can.
If you may, that is
No choice.
So when one suffers from stroke, what happens next?
What happens next? Of course, we have to face the fact that stroke is an emergency. You have to realize that you have to go to a medical institution, to a doctor to see you. And there's already types of stroke. If there's a so-called a window for which you develop the symptom about 3 hours, there's a medication that can be done to somehow reverse the process, especially of blockade. Not only that, especially good control of blood pressure and of course other attendant factors may be controlled upon. So, in other words, as we say in Tagalog, huwag magdali-dali lang na ano. I mentioned something anecdotal a while ago that, I have a young patient who suddenly developed the power to communicate. And of course, the parents thought, oy, namatanda lang yan, ganyan and everything. And the husband said, mukhang stroke ito eh. So, but she came to me 2 weeks thereafter. And I said, mas magaling ka pa mag-diagnose. But the thing is, sayang eh. Somehow, she just followed up a few hours prior to coming here. And she somehow is improving. So the thing is, don't hesitate. As I told you, the 3 components of sudden onset of any neurologic thing that you feel, whether it be weakness, numbness, power to communicate, or even imbalance, and that can be explained by vascular factors, meaning the factors that I enumerated a while ago, rush to the hospital, don't hesitate. Sayang yung panahon na pwede nating masugpo yung progress ng sakit.
It can really be
Yes.
life-saving.
Of course, I'm not that old though, but I've been in the practice that long to see how the practice in managing a stroke has changed through the years and how the relatives, the patients respond to stroke nowadays. If you see them earlier and you give the proper medications, unlike before, wala na po kami magawa, tapos na yun. Ganyan lang sinasabi. Pero now, may magagawa ka. Meron pa tayong magagawa. And of course, being a doctor, our aim is of course to create optimism in the patient and the relatives. And somehow you still believe meron pa tayong magagawa.
Doctor, you mentioned, correct me if I'm wrong, you mentioned a 3-hour window.
Yeah.
Yes.
Yes.
So this is correct.
This is a special type of stroke, no? Ischemic, not hemorrhagic.
Ischemic.
We give a special medication. Maybe even if I say it, yung RTPA, as long as he or she meets a certain criteria that he can be subjected to this, pinibigay namin ito. Of course, there's always a fallback. Medyo may kamahalan ito.
But supposing you thought it kailangan yon and hindi pala kailangan yon, is there any harm with giving that medication?
Well, that's why the criteria is very rigid. We have to do an MRI. We have to image the brain, and there's a checklist. There in our association, and of course in our department in Makati Medical Center, we've laid down a checklist for which, if the patient may be a good candidate for this. And see, lahat ng na-subject namin na maganda ang they really respond. Yun lang nga, financially of course, but who will exchange
Right.
wealth for
Life,
health,
yes.
no? You
Well,
may not
yeah.
be able to do
That's right.
anything, but you're...
Bioethically, then our sense of obligation to ourselves
Obligation.
is first and foremost.
And as much as we're in the topic, Father, in fact, in certain states, not here in our country, if the patient meets the criteria, you cannot deprive the patient of not giving this medication. But
And that's
remember,
right,
this
okay.
is in states where
In the US.
most of them are covered by insurances.
Yeah, that's right.
I'll give you I'll give you a ballpark figure. It may cost something like 250 to 500 to administer
Oh
this.
my God.
An idea, you know how prices change through. Yun lang. Pero sa lahat ng nabigyan ko so far, maganda naman. Pero rigid yung criteria. No, hindi ganun kaliwat kanan bibigyan namin yan. Kasi the harm, yes, of course, you may
There is.
induce a bleed.
It will aggravate
Oh,
lalo
yeah, yeah.
or wala, pero
Wala
magkakaroon
magkakaroon
later.
ng bleed.
Oh my God.
So, anyway,
That's where the
Uh,
competence of the doctor comes
yes,
in, maybe, I
competence will come.
suppose.
And here,
and other symptoms.
definitely it should be administered in a hospital. And it's not only one person responsible for this when we administer. We have a neurology response team, which is called once a patient comes to the ER and he's within the 3 hours window. Meaning, kapag nangyari pa lang. Hindi pwede yung
Afterward.
dinala mula
Ah.
sa yun ang bilang mo. Hindi. Kung kailan siya unang nakaramdam niya nito, tapos pumunta doon,
Right.
yung time na pumunta sa ER. Halimbawa, minsan, nagising siya, may weakness yan. Yan, medyo questionable na yun.
When
Hindi
it
mo
really
alam, maaaring sa
started.
pagtulog niya, nagkaroon na siya.
I see.
What
The
about
miracle
the cost?
drug.
The cost of the medication. Could it be covered by our healthcare system, whether
Do they
private
cover
or
it?
public?
The insurance, the HMOs?
Mhm. Depends on the HMO. I have to be honest. I used to memorize what are the because of course my interest is not only for the of course definitely for the patient, but even if we give it and later on the patient will say, "Dok, kung mahal naman pala ng binigay niyo, hindi namin kaya."
Right, right.
So iniisip rin namin 'yun. But in terms of coverage, some insurances do cover, but to a certain extent lang because of the expense.
Not 100%.
No, I don't think so. Don't think so.
So even the PhilHealth
Partly
contributes
they
a
may
bit.
help.
Well, the PhilHealth is only
Contributes a
how many
bit.
percent?
How many percent
of the
lang yan,
whole
pero
treatment?
But we can still use it.
Right,
helps,
right.
right.
It will add.
it will
It
add.
will add, and certainly is going to alleviate a little bit of the whole expense.
Yes.
And that's good enough.
Kaya mas mura pa rin ang prevention, right?
Oh yeah, that's why we have always have to stress that, and not only for the general population, but especially for those patients who suffered from stroke, because the probability of having another stroke is always high. So it's not only prevention for the family, but for the patient themselves. You have to stress the fact that you are prone to having another stroke. Okay, because all the factors they have already interplayed in for some time. Hindi naman overnight yung nagkagulo-gulo yung blood pressure mo, nag-iba na yung tsura ng blood vessels mo, naging makipot na, naging malapot ang dugo mo. It took some time. So that's why you have to stress this to the patients who suffer from stroke. That's why you hear a lot of patients who say, "Ay, Doc, nagka-stroke ulit yan nagkaganyan." Pero right now, as I said, technology, science, of course, Father, hindi na
Right.
porket andito, religious ako, iniisip ko talagang nakakatulong yung somehow nag-iba na ang senaryo, no? May nagagawa tayong kakaiba, hindi katulad ng dati.
Right. Resign ka na.
Dati, hindi, totoo yun.
Pero Perry,
Right,
what is
right.
the effect, advantage of rehabilitation after a stroke?
yes, they
Would you
do.
really advise it?
Oh,
Kasi
yes.
kung minsan gastos din yun eh.
Yes,
Diba?
I know. Kasi
Although
most of
not
the
that
time, it depends
expensive.
on the deficit. Ibig sabihin, the disability acquired after the stroke. Kasi hindi lang naman panghihina. Minsan, the power to communicate. And if he's a laborer, the power to even operate or
Right.
even think about this. So, malaking problema yan. So, but rehab works in terms of the combination of definitive physical therapy, these are rehabilitative exercises, occupational therapy, the functional use of all our extremities and even transfers. And for some who are affected with speech therapy is, tiyo mo, 3 na agad binanggit ko, magkano pagpupunta sa mga yan. Pero they do help. They do help.
And it's still also covered by insurance,
Yes,
right?
they are to us. Now I know this, to a certain
To
extent.
a certain extent.
Attorney Sara,
Because remember, sometimes you cannot predict how long will the patient maintain to have this
Try to
deficit.
recover, no?
Hindi ba talaga forever. Pero it doesn't mean porket ganun ang deficit nila, you wouldn't subject them to rehab. Why? Because if a patient maintains to be disabled, he is more prone to developing certain illnesses like infection, no, the mere fact nakaupo lang, no, magkakaroon ng sores and everything. So you really have to encourage rehabilitation.
I want to ask Attorney Sara, would it be possible for somebody who suffered stroke to claim from an employer if he's able to prove na the stroke was a result of his job?
Yes, the criterion rather is always if it's work related.
Yes.
But as we're learning in this episode, it can be a lot of factors. It doesn't happen overnight.
Yeah, you know,
so it can be hereditary. It can be so many things other than just work.
Yan ang mahirap talaga. Minsan gusto mong tulungan. Marami tayong siyempre mga kababayan na seaman, no? You have to understand most of them work in oil tankers.
Right.
Yes.
Sobrang init, tapos iilan lang sila, malungkot sila, tapos
Right.
And of course, in the process, they suffered from stroke. Siyempre, masama ko masabihin, siyempre, I try to favor them. Sasabihin ko, as a result of the work, para matulungan naman ng ano. And of course, I take my hat off the shipping lines. They do help naman. But again, to a certain extent. And hindi mo masasabi eh. Pero syempre, pag nangyari habang nagwo-work sila, definitely, sasabihin mo na lang, syempre, mako-cover naman
Work-related.
dapat yan.
They should at least help,
Oo,
no? Kahit na hindi
they do
hindi
help.
mo sabihin
Pero
na...
I have had a lot, not man a lot, in terms of percentage, mga 25%, talagang walang pakialam yung employers.
Yes, yes, of course.
25%.
Of course. This,
And you're referring to beyond shipping lines.
Beyond shipping lines.
Beyond
you
shipping
cannot
lines.
change the nature of the work of a
You cannot
person
change
sometimes.
the nature of
Oh,
the
you
work,
work
tapos, and they are aware, tapos tatanungin mo, i-review mo yung, syempre, you gain collateral information from the work companions. Talagang matindi naman ang work environment. Talagang maproprone siya. Kasi I always try to envision myself, if I were in your shoes, would I be subjected or be prone to it? Yes, no? Pero, yung marami, sorry na lang, I don't know. You hear test,
Very. What about people in prison? Di ba? It's stressful
Yes,
there.
yes.
Do you have experience with the
You know,
number
I've
of
been
strokes
called
there?
to, as you are active, I'm also active in Rotary. Natawag na ako for the
sa
times
prison,
na
sa
sa
prison.
prison. In fact, may mga colorful personalities that I'm handling, but of course I won't mention them, who suffered from stroke, and somehow I treated them. And of course, it happens, no? Siyempre, pero sa tingin ko, hindi ganun kataas. Siguro sanay na sila sa type ng stress na they are in.
Well,
siguro lang, no? I'm not saying.
The recent operations in the Bilibid, have
Hindi, kaya
revealed
pala may reason, panay house arrest na lang. or sa
Split-type air
hospital arrest na lang
conditioners.
sila. Para hindi kasi ng high blood sila.
Oo.
Okay, well, we'll have to take a pause at this point. We'll be right back after a few reminders from our sponsors.